Hello, everybody, and welcome once again to Functional Medicine with me, Dr. Howard Robbins. As you know, our show is dedicated to helping you prevent illness, to and also, most importantly, for many of you, when you're listening to certain podcasts, treat in a safe and effective way, a natural, safe, and effective way. Um, all sorts of diseases and conditions that you might think are untreatable and uncurable. And yet we're able to fix things that are just absolutely amazing. Um, Part of the reason why is we look at the whole body, um, not just the medical problem. And when you understand that the body is a group of interconnected systems, then you understand why we're successful. Um, and particularly with today's show on rheumatoid arthritis. So now let me start by thanking our sponsors, which are very important in treating rheumatoid. First is Promolife.com. Promolife uh, is an amazing company. They make all their ozone products here in the USA. There's for home care, you're going to learn they have a home care setup that people can use if you can't come into a medical office like ours and get intravenous ozone therapy. And that also, there's different types that can help in different ways. And we're going to be talking about that on the show. But if you contact Promolife at 888-742-3404, that's 888-742-3404, and say you want to get set up for ozone home care, and you're going to learn about which types when we get to it in the show. You won't be sorry. Um, you tell them you heard about it here on my show, and they'll do something special for you. They'll give you a % off or throw something extra in. They're very, very nice to our listeners. Then I want to thank, so that's promolife.com. You want to get set up for home care. Their phone number, once again, is 888-742-3404. Then you want to call, or I should say contact, go online and buy doctorsbiome.com. DOCTORSBIOME.com. You want to buy Doctor's Biome. Doctor's Biome is a very special probiotic beverage. Why? They're all living bacterias. They're not in a capsule, powder, or tablet form that's been freeze-dried, killing most of it, and hoping that some is going to come out of what you call suspended animation and live and actually do you some good. So you want to go to DOCTORSBIOME, Doctor's Biome, sounds like Biome, biome.com, and order Doctor's Biome Gut Health or Women's Health. It's all different, or 100% organic juices. And it comes with 100% money back guarantee. You don't have to, for some reason you can't take it, you don't like it. Maybe it didn't help you. Ask for your money back. That's okay. They'll do it. And they won't ask you to send the product if you didn't use it back to them. They'll tell you to give it to somebody else who might benefit from it. That's an amazing way to do business. It has well over a 90% retention rate, which says that once people start taking it and they feel and understand how it's benefited them. And you're going to learn about it, why it's so important in rheumatoid on our show, that they don't stop taking it. They don't stop taking it. And if you use my coupon code, Howard35, Howard35, you'll get 10% off the retail price. Once you know you like it, go on auto ship. I think they call it subscribe and save. You'll get an additional 10% off. That's 20% off the retail price. That's a great deal. You can't go wrong. Doctorsbiome.com. Now let's get right into the show. If you're listening to this show on rheumatoid arthritis, you know what rheumatoid arthritis is all about. Basically, it's an autoimmune disease. It's not typical wear and tear arthritis at all. It's an autoimmune disease. And what's happening is your immune system is looking at all your joints and attacking them as if they're an invader to your body. Um, they cause swelling and inflammation, and eventually they break the bone down in the joint, and you get all these gnarled and damaged joints. They destroy the cartilage. It destroys the cartilage in the joint, so you're bone on bone, and you're going to wind up with joint replacements if they're willing to put them in you. Um, you may just have some morning stiffness from it or just some swelling and inflammation initially, but eventually it can become very severe, just as your immune system weakens. Now, when children get it, it's called Still's disease, juvenile rheumatoid arthritis. And generally, they don't live to a very old age. They die young. So in a sense, it leads to being a life-taking disease. The two things that I treat in our office in Manhattan with intravenous ozone, as you're going to learn, is um, diseases and conditions that will kill you, and diseases and conditions that may not kill you, but will make you wish you were dead. RA, rheumatoid arthritis, definitely falls into potentially both categories. Um, if you read about it on the internet, you're going to hear there is no cure. Well, here's the catch. We have eliminated it permanently, completely, or apparently permanently and completely once and for all. Once the patient stops suffering from it and they don't come back, I trust we got rid of it. The issue is I can't say I cured it. Why? I know doctors will, alternative functional medicine doctors will. You don't know what you got rid of. All the markers in the blood are gone. All the swelling and inflammation is gone. If it hasn't damaged the joints stop being damaged, and I believe stem cells can come in. That's one of the benefits of what we do and repair the tissue, repair the bone, repair the joint until they're really seriously damaged. Once they're seriously damaged, then it's live with it or have surgery done. Um, but we've eliminated it so completely in people that after years of suffering, their symptoms are gone and they feel wonderful again. Why and how? And that's what this show is going to talk about now. So, first of all, we repair the gut. And the reason I'm successful with that is because we're using doctor's Biome. The 15 patented strains survive the stomach and stick to the wall of the gut because they're already living. When they're sticking to the wall of the gut, they're getting yeast imbalance again, which we know can cause joint inflammation when it's overgrowing. And it gets rid of harmful bacteria that may be putting in toxins into the blood that may be part of the cause or for all we know, all the cause of why people have RA. So by rebalancing the gut, getting yeast in balance and putting only healthy biome back into the gut, you can absorb your nutrients that you're taking, the food you're eating that's healthy, and we're going to talk about that a little bit too. And that's I think one of the big reasons why we're so successful with what we do. Then there's ozone therapy. Now, we do intravenous ozone therapy, and only 3 out of, to maybe on a good moment, 4 out of 10 patients have big fat veins where we can use the 10-pass method, as it's called, the hyperbaric high dose ozone, where you take blood out, you ozonate it, and you put it back in. That could be done once, twice a week, sometimes even 3 times a week. But it's the direct IV method where we push the gas directly in. And you can hear more about this on my podcast called Intravenous Ozone Therapy, Everything You Need to Know. There's maybe 8 different ways of doing intravenous ozone, and we use the 3 most powerful ones, and we're going to be adding ozonated glycerin into the mix once it's proven to be safe. That's one of my concerns. There hasn't been a lot of intravenous ozonated glycerin used on humans anywhere in the world. And as doctors are starting to use it more and more, we're going to see the risks that might be involved with it. We've already learned that it's very powerful and you have to use less of it. Can't use as much as they were originally using. And I take Dr. Do No Harm that's 2 veries, very, very seriously. In New York State, they don't care if it kill you with a pharmaceutical. Any of the RA pharmaceuticals couldn't care less if I kill you with it. But if I hurt one person with ozone, they'll put me out of business in a New York second. Um, and then I have to go to sleep at night, and I'm not the kind of doctor that can hurt somebody and go to sleep well at night. So intravenous ozone has been proven amazingly beneficial in eliminating this, along with repairing the gut permanently, completely, once and for all. For those of you that can't get to New York, that can't find any of the doctors that I've trained around the country in your neck of the woods to get the IV ozone therapy from, just don't do any kind of ozone therapy. It may be helpful, but it isn't going to get rid of your problem. And then you're going to talk negatively about ozone therapy. Oh, it didn't work on me. You got to have the right method of medicine, or I don't know. I'm bad with analogies, my wife tells me. But what if you're taking the wrong antibiotic for an infection? It ain't going to work. So what are you going to say? Oh, all antibiotics are no good. Okay, but you took the wrong one. If you have to build a home and you need to bring building materials to house, you're not going to use a Porsche to do it in. You're going to use a pickup truck, okay, a flatbed or something like that that's going to bring all the supplies to your house. Likewise, if you're going to go in a race, I want to be in a Porsche 911 Targa. I don't want to be I'm not going to drive a pickup truck or an SUV in a race. Got to have the right vehicle. So saying I've done ozone therapy is saying it doesn't say very much. The method that you're using is key and essential. And in this case, the direct IV method, in combination, if you can, by itself, it's fine, but in combination with hyperbaric high dose ozone is the way to go. And it's not fast. It takes a lot of time. I mean, most people who have this have had it come on for years or have had it for years. Figure months at the very least to a year or more of treatment to really overcome this medical problem. It's not going to be a walk in the park, snapping of the fingers, and suddenly you're well. The good news is you'll start to notice early on some benefits. It'll stop progression of the autoimmune disease in its tracks. That's the worst that I've ever seen. And yet, if you stay with it long enough, it can reverse and turn everything all around. Now, and by the way, no moral and ethical doctor should ever promise and guarantee a result. I don't care if you're successful 10,000 patients in a row. You don't know what's going to happen on 10,001 for some reason. There's nothing in medicine, in life, there's nothing in medicine that's 100%. I guess in life we know we're going to die eventually. So there's 100% guarantee. But in medicine, there's no such thing as 100%. While this will work done the way we do it using my protocols in the high 90 percentile, you never know. You never know what's going to be. Now, because this autoimmune disease is basically considered that of the joints, it can affect other parts of the body like the heart and the eyes, the skin, the lungs, blood vessels. It's amazing how It can have effects on all these different things. Now, you can do home care, rectal insufflation. Listen to my show on home care. If you have any questions afterwards that you're not understanding something, you can email me at ozone doctor, OZONEDOCTOR, at yahoo.com, or call my office in Manhattan at 212-581-0101. And they'll get you through to me, and I can give you a little bit of advice. Some people like to push the envelope, and they want to turn one small piece of advice into a free consultation. I get annoyed with that. That's not right. That's not right. But I'm more than willing to help people out and answer one or two easy questions. My patients always say, I have a quick question. I go, yeah, but I only have long answers. Okay. Now, part of the way I help get people well is I don't just put all my eggs in the ozone basket along with doctor's biome. Food and nutrition can play a very big role. Um, a Mediterranean diet, look it up. I'm not going to tell you what it's all about. Seems to help a lot of people feel better. We're going to be doing a show, part two on raw food diet. Raw foodists, amazing. A raw food diet, amazingly great. You should try to keep at least 60 or more percent of each meal with RA a raw food. Vegetables, salads, things like that. But particularly, you want foods that uh, like berries and broccoli and all sorts of leafy greens are really good when you're dealing with this. Avoid processed foods completely. Extra virgin olive oil every day. Organic extra virgin olive oil every day. Flaxseed and chia and walnuts have been known to help in reducing joint pain, along with well, the basic vitamins and supplements, okay? So you need vitamin A, D, and vitamin E, mixed cofferols for vitamin E. Notice I'm not giving you amounts. This is a very serious thing. People have asked me why I don't. Um, because we're all individuals. Some people might be allergic to one form of a supplement, one source that the supplement is taken from. Others may be needing more of some, less of some. This is where you have to work with a functional medicine doctor who can guide you individually into what all these different things are that you should take. So I try to avoid that because I don't want somebody to contact me and go, well, I took your vitamin D3 along with K2 and I wound up having, black and blue all over my body from K2. I understand. This has to be while these medicines are safe, the dosages have to be adjusted to individuals. And as you get older, you don't absorb things as well. This is why repairing the digestive system with the doctor's biome can be important and essential. Um, some people need digestive enzymes to help in the digestion of all these foods. Okay, so and supplements that they're going to take. Um, I mean, but there's so many things that you can use that will reduce inflammation. Oil of wild oregano is very good. Ginger is very good. Turmeric and curcumin, excuse me, curcumin are also very valuable in this. Glucosamine, and glucosamine sulfate, very valuable to take. Um, um, for this problem. Uh, Chondroitin sulfate, okay, is very good. Um, Daily, by the way, daily. I'm just trying to think. There was one more. It's can't, it's not coming to my mind right now. Um, we take it, boron. Okay. You can get boron. That's a trace mineral, and you take very small amounts of it. But boron is very, very good for joint problems. Um, Most people with RA are very low in D, vitamin D3, and you can take large amounts of it. You don't have to worry about that. Remember, you got to balance it with vitamin K and magnesium and vitamin C. Otherwise, you're not going to absorb it well. Um, You can treat it, well, acupuncture is very valuable, chiropractic to make sure you're in alignment so you get the right nerve innervation to all your organ systems is very important. You want to swim, okay, because swimming or deep water walking, put on these special life belts. If you want to call it that, that keep you suspended in deep water so your feet don't touch the ground, so you can do exercise in the water. That takes all the pressure and stress off your joints. Tai Chi. Oh, Tai Chi is amazingly good for this. Um, it opens up all the and with along like with acupuncture, all the meridians, so you get the right energy flow. Um, you can ice it 10 minutes on, 10 minutes off. If you have a painful joint as well, that's more local kind of care. Um, um, those are the things that you should be doing on a daily basis. Okay, a daily basis. Now, you don't do everything every day. I mean, other than the supplements and eating the right kind of foods, that you can do every day. Um, but you can, you be going to chiropractor at least once a week and getting acupuncture at least once a week and um, swimming 3 times, 4 times a week, or doing stretching exercises in a pool, light aerobic workouts, walk in a swimming pool. Um, these are things that you can be doing every day. Now, I go 4 times a week now to the gym, trying to get back into condition at my age. And, uh, since I had my new hip put in, couldn't save it. Now I have a hip that's good. I'm 70, going to be 78 next month, and from the time I'm recording this show, and it's good. It's supposedly going to keep me good until 102 to 107, maybe longer. So in any case, yeah. So I go and I do an aerobic workout, on a bike first because it's easiest for my back and joints after 18 years of judo. I get chiropractic every week. Um, I go and then I do my weight training 3 times a week, and then I go into the pool every time I go to the gym after I've done the bike. If I don't do weights, then I go right into the pool after my biking. And the key is to stress your heart, stress your circulatory system, build it up, get it back into condition again. Um, when you're exercising like this, you increase your endorphins and exosomes um, in your body. And the endorphins help control pain. Your stem cells and exosomes increase, and that can help in the repair along with ozone stimulating natural stem cell activity and exosome activity in your body that can help with the repair of all this. So these are the things that you need to be doing in a regular way. And if you're doing this in a regular way, you can reduce RA and in my experience, along with intravenous ozone and the things we do in the office, completely overcome it. Is it cured? I don't know, but I'd like to believe it is because of all the people that we've treated with it, not one has ever had a return for more care, which is kind of amazing. Okay. And you would have thought after, this is my 36th year of my 52 plus years as a doctor. doing intravenous ozone therapy, over 430,000 treatments as of the date of this show recording, more than any one clinic in the world and more than all the doctors, I think, in North America collectively. I don't put all the different ways they've done it together. They haven't equaled what I've done. And uh, one would expect, as I've had returning patients over time, that somebody with RA would have come back if I helped them in the first place, and hadn't happened yet. So I have to believe we've been nothing but enormously successful with it. I hope I've given you enough help and ideas now on things that you can do um, uh, to try and help reduce your this horrible life that you're living if you have RA. All right, and turn it around and start living a happy, positive life. I shouldn't ignore, and one last thing to say is you might want to go to Louise Hayes and start doing and learn some of the stuff she's done and do you don't go to her, she's gone, but you can read her books and give positive affirmations about all this. Your outlook on life, whether you're in a negative, stressful state all the time, will lower your pain threshold. You want to uplift yourself and uplift your life. Stay away from the news media and all this horrible stuff that's going on in the world all the time. Can't do anything about it. It's stressing you out. And as your body stresses, as you worry over every little thing, you lower your pain threshold and weaken your immune system. So this is very important to boost yourself back up again, okay, with positive affirmations and a positive attitude on life. I hope I've helped you all. Um, Please subscribe to my station. This is very valuable and important to get subscribers. I thank you so much if you do that. Use our sponsors, promolife.com, 888-742-3404, and go to Doctor's Biome. By the way, they're selling it. They sell out all the time. You're going to probably be on back order when you try to get it. So don't be upset because you can't get it instantly and there's nothing else as good or even like it on the market. Doctorsbiome.com. And then, of course, call my office in Manhattan at 212-581-0101 and make an appointment. Come and see us, and we can help you. Also, you can email me at ozonedoctor, OZONEDOCTOR, at Yahoo, YAHOO.com. Everybody stay safe, stay healthy, stay well, and we'll be back again on our show very soon with new episodes. Bye-bye now.